Today we'll compare the two most known drugs for erectile dysfunction, Cialis and Viagra. What's different in how they work, how you take them, and their side effects, and whether you can combine them. I'm Professor Henry Callere, vascular surgeon specialized in men's health and erectile dysfunction. So, how Cialis and Viagra work? Both drugs belong to the same family, PDE5 inhibitors. They help the penis fill with blood for erection to develop. How both drugs do it? By relaxing the penis arteries so that they become larger with more blood flowing in. It is like opening up the tap for blood to flow into the penis. These drugs also swell the erectile tissue, the sponge within the penis, so that blood can easily flow in. Those drugs help erections by increasing the quantity of blood arriving to the penis and by creating more space in the penis to stock blood and therefore to be larger. What can you expect from those two drugs? Different things or not? They do not replace sexual stimulation. In fact, they amplify but do not create a vascular phenomenon at the origin of the erection. Consequently, there is no sexual stimulation, there will be no erection. In other words, those drugs do not replace desire. Do they replace neurological stimulation? No, neither. They cannot trigger the neurological stimulus to provoke erection, so they are usually not the solution for men with neurological problems. Men with neurological issues benefit from self-injection treatments, but not from those pills. You must know that Cialis and Viagra do not block venous leakages. They open the arteries, but they don't close leaking veins. However, they can help patients with moderate venous leakage to compensate for moderate blood flow escape from penis. In all these situations where Cialis and Viagra are not in frontline treatments, they may help nevertheless because they make erection easier, and so they shift balance on the good side. By the way, how Sildenafil effect on erection was discovered and how it became Viagra, it is a very funny story. I will tell you this later in this video. So, why take one or the other? This is the big question. Are Cialis and Viagra different when it comes to efficiency? No, they're not different. Both Viagra and Cialis are absolutely similar when it comes to efficiency, with a 60 to 70% of men responding well to both of those drugs. Both also become inefficient when testosterone in blood is too low. So, it is not because of efficiency or differences in efficiency that you will choose one over the other, but for other reasons we are going to see in detail right now. Let me jump into the main key difference between Viagra and Cialis. And this main difference is regarding Sildenafil, commonly called Viagra. You take it just before the intercourse, because Viagra works in the short term. After 5 hours, there is no more efficiency of Viagra. And what about Tadalafil, called Cialis? Well, you take it daily in the long run, and when you will have an intercourse, it will be ready, active, to be used. Of course, only if you take it daily. In summary, Viagra is the one-shot drug for one occasion. Cialis, taken daily, means permanent availability. This is why Cialis or Tadalafil is so popular. It preserves spontaneous for intercourses. You don't need to think in advance to take the medication. It is already in your blood, ready to act. That said, Cialis can also be taken only before intercourses like Viagra and not daily. And this is for men who don't wish to take any medication daily, but who have side effects with Viagra. So they want to try Cialis just before intercourses. There are other differences you want to know because they have practical issues. Let's dig into it. What is the difference between the two on how fast they work after you just have them? If you consider taking your erection pill before intercourses, here's the difference regarding delay of action. Viagra needs half an hour to 1 hour to be effective. It's faster than Cialis. Cialis actually takes 1 hour to 1 hour and a half, so it's longer. Viagra is more rapid to get active. And now, how to take them? Are there differences? You know that when you swallow a drug, you need to wait for this drug to go from your stomach to your blood and then to cells in your body to be active. This process takes time, and there can be differences between drugs, and also according to what is already in your stomach when you take the drug. Well, another important difference between Cialis and Viagra is that Cialis action will not be delayed if you had dinner before making love, because Cialis absorption is not influenced by fat in the stomach. On the contrary, for Viagra, it's very different. You better have an empty stomach, otherwise you will take a longer time for the drug to get into your blood and become efficient. The two drugs are also slightly different regarding side effects. This is very important because side effects and intolerance are major limitation to the utilization of both drugs. The two drugs share some side effects and there are differences on other side effects. What is shared by the two drugs is headache, facial blushing, getting red on the face, nasal congestion like a flu, stomach ache, because both drugs prevent closure of the lower esophagus, and this promotes acid reflux from stomach to upper parts of the digestive system. So both share side effects, but if you are uneasy with one drug because of those side effects, you can try the other drug, because side effects may vary according to individuals. And now, what are the differences in terms of side effects between Viagra and Cialis? Viagra induces visual changes more frequently than Cialis. Those visual side effects are a color perception change and the Viagra with a blue-tinted vision and light sensitivity. The risk is higher with higher doses of Viagra, and it is reversible within hours. If a vision drop also appears, see an ophthalmologist as soon as possible. Cialis, on the other hand, provokes back pain and muscle pain more frequently than Viagra, and this is a problem. It can be as high as in 10% of patients. Now, how to choose between the two? On the one hand, I advise Viagra if you have occasional sexual activity and you don't want to take medication for a long time. You prefer fast-acting pills. You want to first test before considering daily therapy with Cialis. I also recommend Viagra for patients who may have heart tissue, because in case of serious problem, Viagra will be cleared off from circulation faster than Cialis, and it will be easier to recover from this heart problem. On the other hand, I advise Cialis if you want more spontaneity, if you don't want to think about pills for making love, if you prefer a longer duration also. And also, if you have mild urinary symptoms or benign prostatic hyperplasia, because Cialis also helps urination with a large prostate. And can you combine both of them, Viagra plus Cialis? Combining is not recommended routinely. Both are PDE5 inhibitors and may cause low pressure. However, in very selected cases under medical supervision, low daily Tadalafil plus occasional Sildenafil may be tested for resistant erectile dysfunction, but never self-combine yourself. My promise. Let me tell you the story of Viagra invention. Initially, Sildenafil, that's the name of the drug, was a drug tested for heart disease. During the trial, doctors did not find benefits on heart disease, so they were very disappointed. But at the end of the trial, the participants were asked to give back the remaining pills to the laboratory. Those with the placebo pills would give the pills back very easily, but those with pills with Sildenafil, the future of Viagra in it, were constantly very reluctant to give pills back. They were asked why they didn't want so bad to keep the pills. And here it comes. They talk about non-expected side effects on the drug that was in fact very interesting. Pfizer understood the importance of this discovery right away. And this is how Viagra was born and appeared on the market in 1998. Conclusion. Both Cialis and Viagra are effective and safe when prescribed properly. Cialis offers long duration and flexibility. Viagra offers fast onset and control. The best choice depends on your sexual rhythm, lifestyle, and medical profile. If you found this video useful, like it, share it, and subscribe to learn how to preserve your erections for life. I'm Professor Henry Callere. You can also visit our website, www.drallaire.com, and get our free 30-page guide, Reconnecting Men to Life, explaining erectile dysfunction and how to recover natural erections. Thank you for listening.